Sheila, I see you are no longer limping. It seems like you were walking around in pain for the longest period of time.
Yes, Ted, it did seem like I was having a foot problem that took forever to get better. I will tell you, until I finally went to the podiatrist, I thought this problem would never end.
What was the outcome of your visit to the podiatrist?
The doctor told me I had a condition known as capsulitis.
What is capsulitis, Sheila?
Well, Ted, if you recall, the ball of my foot was killing me. I had no history of trauma to the foot. I found that my foot hurt the most when I was walking barefoot on my hardwood floors, or whenever I wore a shoe with any kind of heel. It seems the higher the heel I wore, the more pain. Apparently, I overstretched the ligament that attaches my second and third toes to the second and third metatarsal bones.
Well then, how did you develop this capsulitis?
In taking my history, the doctor made me realize that this probably came about after I had done some gardening. Apparently, when I was kneeling down on the grass, my foot was in such a position that I was stretching my toes upward, and in doing so I overstretched the ligaments. The problem here is once you have the problem, every time I walk either barefoot on hard floors or with heels, I just end up aggravating the problem.
So, what did the doctor recommend?
Well, first he examined me to rule out other problems. Evidently, conditions like Morton's neuroma, bursitis, or even metatarsalgia can be mistaken for capsulitis. He also took an X-ray to make sure I did not have a stress fracture. Once he confirmed the diagnosis of capsulitis, he gave me a couple of options. For relief of pain, I had the option of either oral anti-inflammatory medication or a cortisone injection. I opted to try the oral medication with the knowledge that I could always return for an injection if the oral medication did not work.
Did the oral medication work?
Actually, quite well. But there is more to it. Because I had been troubled by this condition for over 3 months, and because I am so active, the doctor also recommended an orthotic with a metatarsal pad built into it. He also mentioned that my hammer toes are also a precipitating factor in capsulitis. Because of the way they are bent up, they add to the overstretching of the capsular ligament.
What is a metatarsal pad?
A metatarsal pad is applied to the top of the orthotic just behind the ball of the foot. What this pad does is diminish the overstretching of the capsular ligament. As you diminish the overstretching, the ligament has a chance to get better.
Well, Sheila, thanks for the education on how to treat capsulitis.